All right. Well, Courtney, I think we could probably get started. Is that okay with you?
Yes.
Wonderful. Well, let me just welcome everyone again to our first webinar around finding support after an amniotic fluid embolism. This webinar is really for anyone who's been impacted by AFE, both AFE survivors, those grieving the loss of a loved one, family members or spouses, as well as healthcare clinicians or birth support partners. So, I would say after doing this work for 12 years, I'm not surprised at how large the ripple is when an AFE occurs. Everyone is impacted. So this is really meant to help you navigate how to find support both within our organization and outside of our organization. So I'd like to go ahead and introduce our main presenter and panelist, Courtney Diffner. Courtney is a licensed clinical social worker, and she has been working 15 years with a vast amount of experience working with adults and adolescents, children in the inpatient and outpatient setting. She received her bachelor's degree in psychology from the University of Colorado in Boulder, and also got her master's degree in social work from Smith College in Massachusetts. So boy, you're in Southern California, you went to the mountains, and then you went all the way to the East Coast. I love it. She's participated in postgraduate training at the Ackerman Institute for Family and Family Therapy and completed an extensive grief training program through Our House, which is a wonderful organization. She also attained her certificate in maternal mental health through Postpartum Support International. She is, some of you may be familiar with Courtney. She's actually our peer group facilitator. So she facilitates our small peer groups that we have through Zoom that we piloted back in May and found that they were extremely successful and helpful. And so she's doing those weekly with us for a variety of outcomes related to AFE. And we'll get into that more in just a little bit. And then I did want to share, because I think it is important for those of you who are listening in, is just to share our personal experiences and our connections to AFE. My personal experience is that I'm an AFE survivor. I had an AFE during the birth of my son 12 years ago. It obviously spurred many life-changing events for us. And this is how we got the AFE Foundation. Is I knew that there was something that I wanted to do for all of those who'd been impacted and really initiate research. So I've spent the last 12 years working with families and clinicians and trying to do our best to offer support. I came to know Courtney very shortly after a very close and dear friend of hers suffered an AFE and passed away, and come to know Courtney and her family through that connection. And one of the things that Courtney has done is, she has the personal experience and the professional experience. And I think that's what makes her so unique and so special to our group. So I think it's important that you understand our background and understand that when we do offer information, that it's truly coming from a place of understanding in many ways. So without further ado, Courtney, I will welcome you. Thank you so much for joining us, and thank you for participating in such a wonderful way and all this information that you're going to share with us. So I'm interested in listening in. So thank you. I'll turn that over to you.
Well, thank you so much, Miranda. It's absolutely an honor to be a part of this amazing organization. And I'm so thankful to you all for coming today. And we're going to share some brief information. And I hope that we can answer your questions about trying to find support or trying to find a therapist as well. So I did want to start briefly with just talking a little bit about what is birth trauma. And so, I think it's helpful to think about what trauma is in general. And trauma is an emotional response to a frightening event like a natural disaster or an accident. But I think what makes birth trauma so unique and complicated is that it follows an event that was supposed to be happy. It was supposed to be celebratory. There was a lot of expectation and a lot of disappointment and sadness that goes into something that's supposed to be happening, turning into a traumatic event. Additionally, it's so difficult to focus on emotional healing when instead of being able to focus on yourself or your family member, that now you have this infant that you're taking care of, or perhaps you're dealing with grief. And so lots of people, in addition to the mom, can be affected by birth trauma. Spouses and partners, children, family members, healthcare clinicians, labor support partners. Sometimes you hear words like second victimization or secondary trauma, vicarious trauma. And so just thinking about how many people can be affected in a birth trauma. And this leads us into post-traumatic stress disorder. So oftentimes we think of PTSD as something that only happens to people in the military, but just a reminder that it's not. It's a serious condition that can affect anyone after experiencing or witnessing a traumatic or scary event where there was serious physical harm or the threat of physical harm or the fear of death. And PTSD has lasting consequences. The severity and duration can vary, and sometimes these symptoms show up immediately after the event, 3 months after the event, but they can also show up years later. So some of the symptoms of PTSD, fear, feelings of helplessness, negative mood, anger or rage, avoiding people after a birth trauma. This can even mean avoiding your baby because it's the source of your trauma. Feeling isolated or trouble concentrating, easily startled. So our bodies were meant for short-term stress, right? An accident, a natural disaster, these short-term things that we cope with, and then they're over. But we see PTSD when we are sort of stuck in this feeling of stress, and a lot of physical symptoms that can come up with this: blood pressure changes, stomach problems, IBS, sleep disturbances, and nightmares. And so in addition to PTSD after a trauma, mothers and fathers can also have a perinatal mood or anxiety disorder. So it doesn't have to be either one, it could be both. And we often hear people talk about postpartum depression, but it's not always depression. It could also look like anxiety or a panic disorder or a bipolar disorder, obsessive compulsive disorder, or even psychosis. And obviously these disorders can affect you at any time in your life, but they're very common during the pregnancy and postpartum period. So just a brief overview of the types of support that are available. So the number one thing I recommend is therapy with a licensed professional. But there are also support groups. You'll hear more about the support groups that the AFE Foundation offers. You may also find therapy support groups in your community where a licensed therapist maybe follows a set curriculum or has a very specific way of running the group, versus peer support groups where you're in a group with your peers, sharing with other people with similar experiences and sort of navigating that together. Apps, there's some great apps out there like Calm or Headspace that can help with sleep and mindfulness and meditation. And we will also suggest some books at the end of today that can help you with seeking support for birth trauma. So types of therapist. I think this can be really confusing. Like, what are all these acronyms? Who can help me? So a psychiatrist may do a little bit of therapy, but the psychiatrist is the only therapist that can prescribe medication. So a psychiatrist is a medical doctor. You will probably see a talk therapist in addition to your psychiatrist, but the psychiatrist, again, is the one that can prescribe medication. So psychologists or PsyDs are they're doctorate level clinicians. And then next we have our master's level clinicians. And so these are licensed professionals that have a master's degree and then have gone on to get hours towards a licensure. So these acronyms are going to be different state to state. So I apologize if these aren't exactly correct, but some of them that you might see in your state is a licensed a marriage and family therapist, a licensed clinical social worker, or a licensed professional clinical counselor. And you'll see I also have associates up there. So if you see the word associate or intern, this might be someone who has completed their master's program, but is still working on their hours to get their license. If you are looking for medication, but maybe already have a therapist, in addition to a psychiatrist, you can also find a nurse practitioner, or your OBGYN, or even your family physician can also prescribe medication. And life coaches do not provide therapy, and they are not trained to work with trauma, but they may be really helpful if you're having issues with sleep. And so you're looking for a sleep coach or a parenting coach, or maybe career coaching about going back to work after a birth trauma. So there are lots of different types of therapy. I kind of hate narrowing it down to 4, but just in the interest of time, we're going to talk about these 4 types of therapy today, but just know that there's many more out there. So EMDR, eye movement desensitization and reprocessing, cognitive behavioral therapy, somatic approaches, and narrative therapy. And so I know a lot of you are excited to hear, what is EMDR? And I actually heard someone say recently that they wished they had called it something else, because eye movement desensitization and reprocessing sounds kind of woo-woo and weird. And it's really not. It's really an exciting type of focused therapy that can help resolve unprocessed traumatic memories in the brain. And so really briefly, the idea of EMDR is picking a target memory, specifically the hardest or most traumatic memory, or even a word that represents the trauma. And the therapist uses bilateral stimulation. So we're trying to stimulate both sides of the brain. And the therapist may do this with their hands. You're going to follow with your eyes back and forth while thinking about this memory or target word. They may also use tapping. So you may tap your legs. They also may use buzzers, where you have a buzzer in each hand that vibrate like bzz, 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 back and forth. The therapist may control how fast the buzzing moves back and forth. And so this bilateral stimulation helps reprocess the memory and then lower the stress of the event or memory. And so the goal is to lessen the effect of traumatic memories so that you'll be able to recall some of these memories or this target word, but without a trauma response. This is usually an 8-phased approach. And just so you know, you may not do the bilateral stimulation on your first session. So if you sign up to do EMDR, there may be many sessions where your therapist is going to take a history and talk about kind of resourcing, like your images of safe places or how to calm yourself or other coping skills, sort of before they get to this bilateral stimulation piece. The really neat thing about EMDR is it can be used on past, present, and future memories. So if we think about birth trauma, if you are thinking about having another baby, or if you have another child that's going to have a baby after somebody else in your family suffering an AFE, or if you're a clinician, EMDR can be used to help prepare you for these future events. And again, it's just believed that that recalling stressful or traumatic events is less emotionally upsetting, maybe when your attention is diverted or distracted by this bilateral stimulation. So cognitive behavioral therapy. Sorry,
Courtney,
Miranda, did you say something?
yes, sorry to interrupt.
Yeah,
We did have a couple questions about EMDR, and so
yeah,
I'm thinking that
absolutely.
maybe we could jump into those. So one of the first questions is there a specific type of therapist that does EMDR?
That's a really good question. So the answer is yes and no. So you can be certified in EMDR, and so you can look for somebody that is certified, which means they have taken very specific training, they've had specific supervision, they have maybe done EMDR themselves. You may also find a therapist who uses EMDR techniques, but has not necessarily completed all the training to be certified. And I'm sure there are different opinions out there about using someone that's certified versus somebody that uses these techniques.
And I know that you're going to get to questions about what you can ask therapists in terms of when you're finding a therapist for you. And so that might be a really great question, is to talk about, exactly if they are certified in EMDR, or if they feel comfortable doing EMDR without having that certification.
Yes.
Another great question that came in, especially as it relates to EMDR, and this may be answered simply that maybe EMDR isn't the type of therapy, because I know you're going to talk about other therapy modalities, is, many people impacted by either trauma to themselves or being around a traumatic event, whether it's a clinician or a family member, have memory issues. I know many AFE survivors, that's one of their greatest frustrations is that sometimes the lack of oxygen to the brain can actually do permanent damage. And so one of the questions comes in is what would you do if the trauma that you have is that you don't have a memory? And so maybe not being able to actually recall these events. So is it that EMDR is really for those who have a traumatic event and are triggered by the event and have to recall it? And so I guess my question is can those with memory challenges do EMDR? Would that be a therapeutic option?
I would say yes, because if you go back to the idea that you could pick a target memory or a word that represents the trauma. So even if you can't remember the details, if thinking about the trauma elicits a really strong trauma response, like if you have PTSD, then I think that the therapist will be able to help you find a memory or word that connects with that trauma. Does that make sense? So maybe it's not going to be the specific memory of the actual event, but maybe just thinking about the last thing you remember is traumatizing, or maybe thinking about the first thing you remembered after you woke up from being in a coma is the most traumatizing. But it doesn't have to be the actual. Does that make sense?
Yes.
Right.
We also had another comment, which I think is also helpful, is someone, yes, they said that was helpful. So thank you. We also had someone who actually has successfully gone through EMDR and found it to be extremely helpful, and said that her certified therapist had told her it is, and described it as taking a memory out of storage and attaching new meaning to it so that it's not as traumatic or no longer traumatic. So I think that was very helpful too. So I'm glad to see that.
Description.
Yes, so thank you. So I know that there's different modalities. And if anyone has any other further questions, feel free to go ahead and put them in our chat, and we'll do our best to get to them as we have these slides up. So I'll let you go ahead and continue. Thank you, Courtney.
Thank you so much. I really appreciate those great questions. So EMDR is fantastic, and it is highly recommended. And I don't want anyone today to feel discouraged if EMDR is not available to you. Maybe you live in a rural area and there isn't anyone practicing, or perhaps your insurance doesn't cover it. So I want people to leave here today with more information about EMDR and maybe excited about it, but also knowing that there are other types of therapy that can help with trauma and birth trauma. So cognitive behavioral therapy is another very common form of talk therapy. And here the treatment is really centered around how thoughts and beliefs can affect your feelings, your emotions, your behavior, and the physical sensations in your body. So the goal is to reframe negative thoughts and belief patterns and help return you to a place of control and self-confidence. So I like to think of just a brief example. Sometimes in trauma, we are stuck in thoughts about blame, or if this, then this wouldn't have happened. And so cognitive behavioral therapy can be really helpful in sort of reframing thoughts of blame or guilt. And some adjuncts to cognitive behavioral therapy might include homework. So such things as worksheets, or journaling or reading, sort of practicing, first of all, noticing these negative thoughts and also practicing ways in which to reframe them. Another good approach for birth trauma are somatic approaches. So this approach thinks about kind of a body approach versus your thoughts and feelings. So here we're really thinking about when I am activated by trauma, where am I feeling it in my body? Do I get a stomach ache? Do I get a tension headache? Do I have back pain? And the treatment here focuses on noticing those feelings, maybe bringing sensory awareness. So in addition to sort of feeling pain in our body, a lot of times after trauma, we can also dissociate. And so maybe we have a feeling of just like numbness or just being in a fog. Somatic approaches can kind of hone in on helping to feel things in your body again and learn ways to feel them in a safe way. So the goal is using sensations in the body to release trauma energy. So this might include smells, sounds, taste, tactile sensations. So if maybe there's a smell that reminds you of the trauma, the somatic approach can sort of help reprogram you to not associate those smells with a traumatic reaction. And so a really important part of this practice is the idea of alternating between sensations associated with the trauma and those that are a source of strength and solace. So a therapist might use sort of smells and sounds that are distressing to you with smells and sounds that are calming to you, and sort of going back and forth between both of them until you can learn to feel some solace and calm with those smells or sounds that used to be really reactive or dysregulating for you. I also wanted to mention narrative therapy. And narrative therapy includes forming a cohesive story or narrative of the trauma. And so whether you remember the trauma or not, there can sometimes be a lot of chaos around trying to tell the story or trying to understand the story of what happened to you. So the goal here is maybe highlighting stories of strength and meaning making. A story of a trauma could be told hundreds of times in hundreds of different ways, from your perspective, from the perspective of somebody else that was there. And retelling the story from different perspectives, or maybe even by adding a new character, imagining if your grandmother had been there, can add a sense of meaning or hope to a traumatic event. And this sort of therapy can be done with a therapist in terms of talking and telling these stories and building on these stories together. And this can also be done in a writing form as well, which some people find really healing. So we've talked about these different types of therapy, like how do you find a therapist? Just this starting place can be really overwhelming. So first place is asking your healthcare provider, your OB or your family physician, asking family or friends or coworkers, and you want to have a great therapist that they like. You can call your insurance company and say, I need to get a list of the covered providers in my area. These are 4 great websites. So most therapists I know advertise on Psychology Today. And the really cool thing about this website is it works like a search engine where you can type in your zip code, you can type in your insurance, you could narrow down EMDR, and you can find someone ideally that is in your zip code, takes your insurance, and practices MDR. So Psychology Today is a great way to narrow down to specifically the therapist you're looking for. Open Path Collective is a really great resource. So this is intended for people that don't have insurance or don't have mental health coverage. Therapists here advertise offering a few spots in their practice for low fee clients. So it is $50 to join Open Path. It's a lifetime membership as the client, but then you pay $30 to $50 a session for therapy. And similar to Psychology Today, you can search by zip code, you can search by EMDR or cognitive behavioral therapy or whatever specialization you are looking for to find a therapist that meets your needs. Postpartum Support International, their website, postpartum.net, has a directory of therapists with advanced training in perinatal mood and anxiety disorders. Many of those therapists also have training in birth trauma and grief and loss. And there's also the Birth and Trauma Support Center. They have a specific referral list for therapists who have training in birth trauma. So therapy in the US is complicated, and how do you pay for it? So it is sometimes covered by insurance and it is sometimes out of pocket. So if you have an HMO, you probably have to find a therapist in network. If you have a PPO, you may be able to get what's called a super bill from your therapist, which is basically a receipt saying that you went to therapy and this is how much you paid for it. And your insurance company may reimburse you for some of that cost. If you have a healthcare spending account, you may also be able to use that for therapy. So just some ideas there about how to pay for therapy. Group therapy, just another option if you're looking to connect with other people or you're just not ready for one-on-one therapy yet. A few national organizations we've listed up here, Grief Share for grieving families, Compassionate Friends for grieving family, the National Alliance of Grieving Children, Return to Zero for infant loss. And again, Postpartum Support International has almost daily groups for moms, for dads, for families that have had a NICU stay, for families that have had a loss. You may find that there are faith-based therapy options in your community, at your church or synagogue, community-based support, maybe at your parks and recreation center, community centers. In the US, sometimes you can call 211 to get some more information about local support to you. The one thing we didn't put up there that I'm just thinking of offhand, Miranda, is NAMI. I don't know if you want to type that in the chat, but it's NAMI, and it's the National Alliance Mental Illness, I believe. That may be a great resource as well.
Yes, they are a great resource. Before we go any further, we did have another question about, if there's been any research associated with AFE survivors in terms of the best type of therapy. And so I'll handle that side of it. And then there were some additional questions with this post. And I won't say that there's been any formal research that's been done related to our registry. That's certainly there's two different research approaches. One is a qualitative, where you get more specific information, versus quantitative, where it's just how many people have attended therapy and did you find it helpful, yes or no. We haven't done anything formal like that with our group. Anecdotally saying having roughly 1,100 members in an AFE survivor group, roughly 3,500 or 350 members in our grieving families group, that the overwhelming response that I see has been a combination of all the therapies. So finding a therapist who's either well-rounded or well-networked to have various approaches. It appears in our survivor group that EMDR has been exceptionally helpful. I can't say offhand if I've seen anyone say, well, it wasn't for me. I think most of the frustration that people find is just having access to it. And I know that it's a well evidence-based practice that's been around for a while, but I think it's growing momentum. And as you sort of already touched upon, at least here in the United States, that mental health and having that be covered is obviously extremely challenging. One of the other questions was, seeing a psychologist and sort of the next step after psychologist. And so, Courtney, I don't know if you want to address this question, but just that this particular attendee is having a hard time right now. She's currently in therapy. She's also currently going through a lot of continued medical therapies. And so there's a great deal of triggers. And so, a very recent event followed by, this continuity of care with lots of follow-up and sort of always being re-triggered. And so would you recommend the next step would be for her to do psychiatry, or could it be in tandem for seeking a psychiatrist and then seeking EMDR? Can you do that simultaneously, or is there a process that you would recommend?
Yes, absolutely. And so it's a little hard to know without more specific information, but a couple things that come to my mind is if you've been trying something for a while and it doesn't feel like it's working, exploring, are there opportunities to make a change, right? Therapists have different styles. Is this person not the right fit? Is it, do you want to try somebody else? Have you grown as much as you can grow with this person? Do you feel comfortable telling this therapist that I'm feeling stuck? I don't feel like I'm getting enough out of this. Are you wanting something different or something more from that therapist? And do you feel comfortable having that conversation with them? I would also say that I think talk therapy works. I think it's wonderful. But if you've been doing talk therapy for a while and it doesn't feel like it's helped enough, then I would be really curious about talking to a psychiatrist or a psychiatric nurse practitioner. And one of the things I tell my clients is you don't have to get a prescription, you don't have to take medication, but go and meet with them, talk with them, find out if they were going to prescribe you a medication, what would they prescribe? What are the pros and cons? But I think sometimes having that conversation is really helpful. And then deciding after that conversation with a prescriber, with a psychiatrist or a nurse practitioner, do I want to fill this prescription? Do I want to take medication? But sometimes it's hard to know the answer to that question until you've sat down and talked with them and gotten their opinion.
Thank you. I think that helps. And I know that another person just shared in our chat, and I think this resonates too with everyone, is it's an evolving process. It's a time, sometimes it's timing, sometimes it's the right therapist. Sometimes, as you said, it's identifying, is it the therapy, is it the modality of the therapy? I know in my many years of experience in various modalities of therapy is seeing them as tools, that these, that I sort of have my tool belt on and I can use all these various types of tools to help me in certain circumstances. And I know just anecdotally too for myself is just knowing over the 12 years that I've been sort of processing this is timing is, there's definitely a nuance about timing, and putting yourself, sort of making it a priority and being first, but recognizing sometimes the timing's not right. So I love that our group is sharing with one another things that work for them. So thank you. I'll let you go ahead and continue, Courtney.
Thank you for those questions. So I feel like this ties in perfectly to this next slide, which is questions to ask when you're looking for a therapist. So some questions I would ask is, how long have you been working in the field? Is this someone that's been out of school a couple of years, or if they've been in the field 20 years? And do you have any experience working with grief and trauma? And this question, I think, is almost more important than how long you've been in the field, right? You could have someone that's a fantastic therapist working with couples, and they've been in the field of couples work for 20 years, but they may not have experience with grief or trauma or birth trauma. Versus you could come across someone with only a couple years of experience, but they've had really great experience working in an inpatient hospital setting or working at the VA where they have a lot of experience with trauma and PTSD. So those are, I think, two very important questions. Do you take insurance if this is important to you? And can you provide a super bill, which is, again, that sort of therapy world lingo of basically it's a receipt that you attended therapy. How would you describe your style of therapy? And I think there's two benefits to this question. One, it just might be interesting to hear if anything sticks out to you about someone's style, whether they're direct or collaborative. But even if you don't necessarily understand sort of what they describe as their style, I think it just gives you an opportunity to hear them. Do you connect with them? Do you like what they're saying? Do you like the tone of their voice? I think there's value in finding a therapist that you feel comfortable with, that you get a good vibe from. And just keeping in mind that idea that it's okay to shop for a therapist and find someone you connect with. And I say that realizing that depending on where you live, you may not have a lot of options to shop. So I recognize that. One silver lining of this pandemic is that most therapists are working via video conference. So if you do live in an area where you haven't had a lot of choice in therapists, now is a good time to find one because you may now have access to everyone in your state. And you can try a video conference and see if you like it. Some people do, some people don't, and that's okay. But if you're having trouble connecting with someone in your community, I think it's a good option. Miranda, did you want to share a little bit more about just Facebook support groups as a way of people getting more support?
Yes, thank you so much. Everything that you've said is really helpful when it comes to finding professionals that give us our tools, of being able to connect with others in our community through group therapy, whether it's, at your local church or your community center or one of the national organizations that you previously mentioned. But I think there's also significant value, again, is having lots of tools, is seeing that there's opportunities to be in a specific support group. And I think, probably most of the people attending today are, involved in one of our support groups. But I think I'll just share briefly that we've learned over the years that having specific support groups directly tied to the outcome is where we find it to be most beneficial and most effective, is being able to connect with someone who truly has very similar experience as you. May not be the exact, but much more similar. And so, like I said, we have roughly 1,100 survivors, AFE survivors in our survivor support group. But we also recognize that some of those survivors have even more complex outcomes. Some have tragically lost their baby. And so it's really important for them to have a space that they can connect with others who are, can sort of share in their grief of an infant that was lost prior to delivery or during their delivery or shortly thereafter. We also have survivors who are, I call them our pioneers, who are women who their fertility remained intact and they're able to sort of explore future pregnancies. And I think that it's really important to have a special place for them to, a separate place for them to talk about the emotions and the triggers and sort of describing that fear that they may have about future pregnancies. And then over the years, we know that there's a lot of times AFE survivors are supported by their spouse or their partner, or even their family members, siblings, parents who have also experienced, as you've said, experienced that trauma and want to be a good support to their loved one, and sort of struggle, but they're also struggling with their own thoughts and visiting those really difficult emotions. And so we also now have an AFE survivor family support group for those who aren't the actual survivor. And this is really beneficial too for some of our families that are still hospitalized when they want to get quick access to connect with someone else. And it's not necessarily the AFE survivor themselves. And then of course we have our wonderful grieving families group, which is anyone who's lost a loved one, whether it is their daughter, a sister, a cousin, a wife, a spouse, a partner. And that group has approximately 350 members in it. And so we have, families really from all over the world connecting with one another. And then we have a specific group just for AFE widowers, just for our dads. This is specific just to fathers who've lost a loved one, lost their wife or their spouse to AFE. And it's wonderful for our dads to be able to sort of talk about the challenges of raising a child if their child survived. It's a wonderful group. We also know that friends, Courtney, just like you, need a place to go and sort of honor their friend and remember their friend. And I think we all can choose our friends, right? We can't choose our families. And so these wonderful best friends needed a space as well to share and connect with others who understand what they're going through. So we have a grieving friends group. And then it goes without saying that our healthcare providers, those providing the care, most especially in a birth trauma setting like AFE that's so unexpected and catastrophic, we know that our healthcare providers really need a space that they can connect as well, and not necessarily share any patient information, but be able to talk about their feelings and the struggles that they may have about staying in that career, in that field. And so these are truly, we do have many groups, and we hope that if you haven't found one or if one of these sounds appropriate for you, you can certainly reach out to us and we'll get you those links. Courtney, what do we have on that next slide?
It is our kind of new in the last year peer support groups.
Yes, these have been wonderful, and thank you for facilitating these. We started to recognize that, the previous groups are available 24/7, right? No matter where you are in the world, you can log in, you can use those groups to connect with others. You can post, where you are in the world and see if there's someone that's nearby. You can search up in the search bar if there's a topic, about anniversaries or birthdays coming up or any topic that you can do in the search bar. But what we started to find, especially when COVID began, was this feeling of isolation that sometimes isn't even negated by being able to connect with someone 24/7, and really having that face-to-face time, but also having it be very topic specific. And we knew that wasn't something that we were versed in, just just through the staff of the organization that we needed professional help. And Courtney, you've been able to fulfill this role for us. So these are very small groups. They are groups of 10 to 15 or less participants. They're done via Zoom so that you can actually see one another. We always say that you don't have to dress up. You can come in your pajamas. You can come as you are. You can come in your scrubs. You can do whatever you need to do. But these groups are wonderful. They're facilitated by Courtney. And as we expand this, we will find other licensed therapists who can help us. I know this isn't therapy, but it's more peer-based. And so you help sort of guide those discussions. But as of now, we have several groups. We have a group for recent AFE survivors, so those who've had an AFE within the last year, who are really just in that difficult space of trying to understand what's happened. And then we have another group, 1 to 5 years. And then we have our group for 5+ years, and those meet once a month on Thursdays in the evenings, and we have more information on our website about those, or you can reach out directly to us of when those are. We post these in all of the groups so that the groups are aware that they are happening and give reminders that they're coming up. And then we also have a group specifically for grieving grandmothers, and these are mothers who've lost their daughters to an AFE, and I know that group has really been able to connect others in a much more intimate way than maybe just posting in the groups. We hope to expand these. We hope to offer more just for fathers. We hope to offer siblings for grieving siblings and for dads. So we recognize that there's a great need. And so if you haven't yet tried one of these groups, we would encourage you, if you're able to join one of these groups, anyone is welcome. And Courtney, I don't know if you want to share any of your thoughts or feelings about these particular groups and how they might be supportive to someone that I haven't covered.
Yeah, I think the only thing I would add is just come give it a try, because it can sound a little weird to do a group online. But it's just really exciting, I think, how connected you can feel even across the video screen, and be able to come together with people truly all over the world, Canada and the US and the UK and Australia, and just sit in the same virtual room with people that have had a very similar experience to you, and just have that connection with other people that truly understand.
Thank you. And I know that you create a space that's safe, that there's confidentiality that's respected. And I certainly have just been able to witness being part of the groups and seeing the friendships formed, I think is really remarkable. And I think having, the only other thing I would add that we didn't add on this is that for our recent AFE survivors, we've also started a new peer mentorship. So we have a group that's being mentored also by a licensed social worker who's also an AFE survivor, and she's been able to connect them through Facebook Messenger. So they have a little bit more touch points and a little bit more time to check in with one another and talk about specific things. So I think that's been really helpful, that sort of blossomed out of these groups. So thank you. If you want to put in the chat, if you want to, you can send me a direct message, or you can put it in the chat, and I'll make sure to send you the links for any of these groups. So as I shared, we do have a staff, and we do have a great group of volunteers who are helping us provide support. And I just wanted to give recognition to our team. Diana Masuli is an AFE survivor and is our support program manager. She is also an LCSW based on the East Coast, and she helps manage all of our support programs, like our support groups, like our peer support. We've done self-care challenges. We've done book clubs. There's a lot of different ways, and a lot of, we also do recognition for our families, for Memorial Mondays, for those who we've lost, for Survivor Saturdays. We do a monthly birthday shout out, for our anniversary shout out in our support group. So Diana really oversees all those wonderful programs. And then we also have Kaylee Summers, also on the East Coast, fairly recent AFU survivor. She does a lot of peer outreach and connecting with new families that are coming into our organization and helping them sort of navigate those challenging waters. And then Katie Imbrogno is on our staff. She is our support group admin. So she's the one who ensures and does the best job of ensuring she keeps an eye on the groups to make sure that if anyone has any specific or urgent needs, that we elevate those needs. That she also is the one who allows and accepts membership into our groups. I think it's important to share that we've taken privacy very seriously and that we have rules and guidelines that we follow very strictly in our groups to ensure that the group is comfortable for everyone to come to. And so we do a great job. So if you do try and join a group, we do ask for an email or a phone number so that we can connect with you. We ask for your connection just to ensure that you're in the right group, because sometimes people end up in the incorrect groups. And so Katie helps oversee this. And so I just wanted to say it's wonderful to have these support team, and they are all very wonderful in ensuring that hopefully that everyone in our groups or in our organization feels that they have access to get the support that they need.
So I think our other idea was just to leave you all with some kind of further reading recommendations. As a therapist, I will admit I'm biased, and I think the first choice should be everyone should go to therapy. But if you're not ready or you're already doing that and you want something else, these are just some books that Miranda and I put together that we think just might be helpful in reading more about grief and trauma. And these are some books for children.
I will just add to that The Wonderful Gift by Quené is actually a book specific to birth trauma. So it's specific to the loss of a mother on the same time as a child's birth. And so it's really geared towards reading it to a surviving child. And we have these available here at the organization. We try and send them to our new grieving families. And Quené wrote this. She lost her sister, Lisa. So it's a very beautiful book. It is faith-based. But if anybody, we're going to send out these slides to all of you and have these slides available so that you can get these links. And I know there was like a shame. Courtney reminded me that all of these books are available on Amazon. And if you do, don't forget to use your Amazon Smile, and then we'll get maybe a portion of your purchases. But these are all wonderful books, and we've gotten a lot of feedback from our families that they're very helpful.
And I just wanted to mention briefly that in these strange times of pandemic, that there are actually some really cool apps that you can do therapy via an app. So it's an app on your phone, and you can do a video chat on your phone. Some of these apps offer text therapy. Some of them it's a phone call. But here are just a few options: Talkspace, Maven Clinic, BetterHelp, Able2, and Teladoc. And some of these are benefits through your insurance plan, and some of them are apps that you can just sign up and pay for individually. So if your insurance plan doesn't cover mental health, or it doesn't cover, or you can't find a therapist that you like with your insurance plan, that these are some other great options, and you may find some kind of packages and things on here that make therapy a little bit more affordable as well. And these are just some other apps to help with grounding, to help with mindfulness, to help with connecting to your body, to slowing down. It's Calm, Headspace, Aura, Insight Timer, Simple Habit, Audible, My Life.
I have several of these apps on my phone.
I love Audible personally. I love listening to books while I am on a walk as just a way of calming my mind. But I do keep hearing amazing things about the bedtime stories on Headspace that are really helpful for clients and friends that are having trouble sleeping.
Yes. And I know that also to add that there, if you subscribe to Netflix, there is a new Headspace Netflix show walking you through the process of meditation or mindfulness that's been really beneficial. So if you're able to check that out, you can check it out on Netflix as well.
Do you want to read the quote, Miranda?
Yes. So we ended this because, we're all on our journey and we're all on this journey and path to processing better and having tools to help us live a joyful, as much as we possibly can, joyful life. And I saw this quote. It's a Chinese proverb, so it's been around for centuries, but it says, "A journey of 1,000 miles begins with a single step." I think that encapsulates because I think the overwhelming majority of people touched by AFE will say that it is definitely a journey of 1,000 miles, where it can feel like it can feel really challenging and very difficult to walk, to sort of pick yourself back up after either losing someone or experiencing this yourself. And so I saw this picture and it definitely spoke to me, that I felt that, with all the information that you provided with us, that and to give people hope that there's light on this path, and if they choose to seek it, that hopefully their path will be more beautiful and more peaceful. So thank you, Courtney. I definitely want to open it up for questions. I would love to hear from those of you joining us. If there's any questions that you have on this specific therapies or modalities, or if you've had any experience with any of the apps or books, we'd love that feedback. So I'll just keep it open here for some questions. And thank you all for joining us. And Courtney, would you, as if questions don't come in, will you just perhaps maybe close this space with just maybe getting us focused back into our bodies? Because I know that we talked a lot about therapy, but it's coming from a place that it's certainly coming from a place that, may not feel great right now.
Yeah. So I will just share a short grounding exercise with you guys. Sorry, I didn't mean to change the slide. And if you've come to the peer support groups, you might have heard this one before, but it's just one of my favorites. But if you want to close your eyes, if you're comfortable doing so, and if you're not, that's okay too. You can keep them open and just have both feet on the floor. And if you could just imagine that you are standing on just like a perfectly warm sidewalk with bare feet. So it's just that perfect temperature that feels really good. It's not too hot. It's not too cold. It's just been warmed by the sun a little bit. And if you can just imagine looking down at your hands and finding a piece of chalk that's your favorite color. So turquoise or purple or peach or whatever your favorite color is. And that if you would just bend down with that piece of chalk and just trace your right foot and just draw each of the toes and drag it down the side of your foot to meet the heel, and then back up into the inside of your arch. And then if you would just move that piece of chalk to your left hand, or you can keep it in your right hand, and just trace your left foot in the same way. So you're just going to trace each one of the toes and draw the piece of chalk all the way down to your heel. And then from the bottom of your heel to just pull that piece of chalk all the way up back to your big toe where you started. And to just sort of wiggle your toes and imagine standing up straight and feeling the warm sidewalk beneath your feet, and looking down and seeing the outline of your favorite color. And just taking a couple deep breaths and just imagining that feeling of just being present, of being grounded in your body. And then just opening your eyes when you're ready.
Thank you. That's a perfect way to close as we talk about this journey of 1,000 miles. And with it being in the month of January right now, I can only imagine we all want to feel a warm sidewalk these days in the warmth of the sunshine.
So, Miranda, I did see two questions up here. One was, what is the best way to get more information about the peer mentor groups? And then someone asked, how do we get involved in the mentor program?
Wonderful, wonderful. So right now, where we're at is I will send, if you want to send me an email to Miranda, Miranda, at afesupport.org, and I'll put this in the chat. If you want to send me an email, and we will certainly look into that. The mentor program that we currently have right now is for recent AFE survivors, and that's led by Kaylee. And then we are looking at building out a mentor program so that as those in this space, based on outcome, whether it's a grieving family or if it's an AFE survivor, that we build out a mentor training program so that we can have more smaller groups that sort of have this. Typically, we've been using Facebook Messenger, or you can use a text group, but that just helps connect you to others that either are close in the timeline from when you experienced a loss or an AFE, or even geographically. So we're still playing around with building that out. It's sort of a pilot program right now. And so if you want to send me that message, I'll let you know. The one for Kaylee right now is for AFE survivors, roughly 18 months to very recent. And then we're hoping to build out more mentorship programs. So if you're interested in being a mentor, or if you're interested in being part of a group, please send me an email. Again, Miranda at afesupport.org, and we'll do our best to connect you. And then we are also looking for one-on-one mentor mentee relationships, sort of like big sister, big brother type of opportunities where there's someone with a vast amount of experience that is in a safe place that they can continue to be re-triggered of partnering up with a like-minded individual who may be new to our organization. So thank you. Great questions.
And I will just add, for anyone that's interested in joining our live Zoom peer groups that meet once a month, if in the Facebook group you look up to the event tab, you should be able to see the calendar of when the next groups are happening, as well as Miranda and I will post in the Facebook group, like, hey, this week, this Thursday, actually, I don't think we mentioned that. The groups are on Thursday evenings at 5 p.m. Pacific Standard Time. And so let's see, the next group is the first week of the month. So next Thursday will be our recent survivor group.
Wonderful. Thank you very much. Well, thank you, Courtney. Thank you for your time today. Thank you all for those of you who joined us. It's always challenging to find a time that meets with all the different time zones. And we thought that Sunday would be a great day if you had, someone else in the home who could watch with children, or that you would have an opportunity to tune in. If not, we will have this recording available to everyone, as well as the slides. So I'll be sending that out tomorrow with the slides, as well as hopefully the link to the recording. Thank you all for joining us. Let's see, I just want to make sure we don't have...
We had just one more question pop up that I will answer real quick. And that was, does everyone have to speak in the small group Zoom? And that's a great question. So I'm going to ask that if you come to the Zoom, that you be willing to at least introduce yourself and share your name and where you live and when your AFE was, just so the rest of the group knows who they're talking to. But beyond that, if you would just like to listen, you are more than welcome to come and listen.
Wonderful. That's a great question too. Yes. I think we have another one. Thank you all for joining us. Thank you, Courtney, for taking the time out to help maybe dispel some or dispel some of the questions that people have or answer their questions. I know that talking about therapy is always so challenging to understand a little bit more about it. Those acronyms are pretty significant. It's like an alphabet soup. So thank you for joining us. Thank you for your time, Courtney. And if anyone has any questions, you can send those to Miranda@aapsupport.org, and I'll make sure to follow up with you. But thank you. Everyone have a wonderful rest of your day or evening.